Well, many Mainers live in rural areas and face transportation challenges, but one group is ensuring people who can't drive or afford private transportation still have access to health care, prescriptions, and essential services. We're talking about Maine's non-emergency transportation system, or NET.
Here to tell us more about the impact this group has are Christine DeCosta, who is a NET driver, and Lydia Lennick from Modivcare Maine. Good morning to both of you. Thanks for being here.
Good morning. Thanks for having us.
Absolutely. So first off, Lydia, could you tell us more about Modivcare Maine and how you're involved with NET?
Absolutely. So NET and non-emergency transportation really creates access to healthcare solutions and removes some transportation barriers, recognizing about 40% of our residents here are in rural areas. Getting a ride or access to their medical appointments is certainly a challenge, and so we want to make sure that they have that access.
Now, Christine, how long have you been a driver and how has your experience been with this?
I've been driving for Modivcare for 3 years. I'm in the region of York County generally. I drive a van that can accommodate our members that are in wheelchairs, and it's very rewarding.
What makes it so rewarding, would you say?
Well, it's so needed. There's a desperate need, really, for very essential services like, medical appointments. They're very appreciative, our members are, and
making a difference.
Yeah, have you heard about some of the people that utilize this and how much it means to them?
Absolutely. It is, I think, one of the most rewarding things. So we also have a contact center here that takes the phone calls when somebody needs a ride, and it's just so nice to hear their gratitude when they appreciate that we're providing that service. And I know Christine hears it from them as well. We really see the riders and those members appreciate that connection and the consistency. So many times we're using local both commercial transportation providers that are contracted, they're certified, so we cover the safety components as well, but it's the drivers like Christine and others that really help make sure that those individuals that may be otherwise nervous to get in a vehicle with a stranger, they're seeing the same face, that consistency and that appreciation, so it takes one less burden from them as they're trying to get well.
Yeah, relieving that stress for sure. How does the whole process work exactly, and who qualifies for this?
Absolutely. So the state of Maine, and it's funded through Maine Care, creates the opportunity for eligible individuals to have this access. And so it is to medical appointments, to covered services. And so our role really is kind of creating that lifeline. So they contact us through our contact center. There's also digital booking options if they so choose, but many folks pick up the phone and call. And so then we pair that individual with the appropriate transportation provider and driver. Christine mentioned the wheelchair access as well. So somebody might need a specialized type of vehicle or support to get to and from maybe their home door to the car door to the medical facility. And so we make sure that those connections are good and accurate. We work very diligently on both a timeliness as well. So 94% of our trips are on time, which meets or exceeds the state standards. So we want to make sure that they're not only getting a ride, but it is on time and they're getting that treatment needed.
Christine, what do you love most about this? I'm sure it's got to be the connections. When somebody, you get that, you see them once a week or once a month or whatever, it's like, oh my God, it's like your friend. And some of the people that live out in the rural areas don't see a lot of people,
That's exactly right. Some of the conversations. I have a lot of regulars, many that we bring to dialysis 3 times a week. Folks with dialysis, and it's really a treasure to connect and to experience, in many cases, heartbreak with the illness of chronic kidney disease. But I meet new people every day too, as well, and it's really enjoyable.
Would you agree that this is more than just a ride for the drivers and the people that are using this?
Absolutely. I think both in our transportation network and in our organization, a lot of us are drawn to it because it speaks at some level personally. Being able to help folks is really what drives many of us. It's not just about going to a job 40 hours a week. It's about making sure that there is that support there. And we've got lots of drivers that are willing to take those oddball time trips and make sure that, you know, somebody needs to get there on a Saturday morning or, you know, at 4 a.m., whenever it is, they're there. They want to be able to do that, and it's very rewarding.
What's the best way for people to get information how they can take part in this great organization?
Absolutely. Thank you for asking. So you can certainly go to our website, modivcare.com, and there's a contact us to get the main details, be able to contact in, make the phone calls, and we can always provide some additional education and support. We also work with our healthcare facilities to make sure that they know of the services too.
All right, thank you both so much for helping out these Mainers.
Thank you for having us.
Yeah, that's great. You guys make new friends. That's
Yes,
the beauty of it too.
absolutely.
I love that.
A service and also making friends.
Yep.
Absolutely.
All right. Well,